Hi everyone, my name is Shanil Pathak. I'm the co-founder of Zamplo, and we're here to share about a digital application to help you and be more empowered. And before we start, I want to head off to Teresa to say a few words.
Hi there. Thanks, Chanel. It's a real pleasure to be with you all today. I'm the president and founder of HPV Global Action. We're the registered charity in Canada. You can change slides, Chanel. Our mission, well, we first cover connecting, empowering, and implementing best practices around Canada. And our mission of our organization is to raise awareness of positive sexual and reproductive health through the implementation of comprehensive education programs that range from elementary, secondary, post-secondary education, healthcare professionals. And we are really emphasizing HPV, what it's all about, its potential consequences. Um, our key is really to empower culturally and ideologically diverse communities around the country to be more informed. So our focus is really on bringing national and international leaders together to communicate and provide solutions regarding worldwide HPV prevention and cervical cancer screening policy changes. And today, I think why we're so happy to be collaborating with Zamplo is really, we find that there's a lot of patients and caregivers that are really in need of these really important resources. So we're really hoping that this webinar is going to give way to people feeling more empowered so that they know how to navigate the healthcare system. And our group will be there to support Zamplo and anybody who has a concern or a specific question around HPV or HPV related cancers. Please feel free to connect with our organization. Thanks, Chanel.
Thank you, Teresa. Yeah. So I'll dive into the webinar, and so some of the topics we're going to talk about is real life examples of using health data to be more empowered. And that's come from my personal journey. And also, what does empowering mean when it comes to physical health, mental health, and also for caregivers? It's important not to forget about caregivers. The importance of collecting your data, and what does that mean? So we're going to go into what we define as whole health data. So it's more than the medical system, more than the reports and labs. And then at the end, we will demo Zamplo, which is a digital tool. And the one thing with Zamplo is it's been created from people like us. It's created from people who've gone through health challenges, be it physical, medical conditions, cancer, or also mental health. And it's talking to groups, patient organizations, and individuals, and especially outliers of what they've been doing, what they found that works, and that was synthesized into Zamplo. And then there's a new feature that we're launching in June. It's called Community, Zamplo Community. And then what's unique about this community is it allows you to match with an individual directly one-to-one, but also you could find a person who's exactly like you, be it the medical condition, medication, or the symptom. And so that's very unique. It's a very private, unlike a Facebook group, and it's meant to have to find a coach, find someone else anywhere in the world that could help you. So a bit about my background. So Zamplo started from my experience as a caregiver. My wife, she was diagnosed at 36 with late stage lung cancer. It came late. A lot of her symptoms were dismissed. And by the time we got the MRI, unfortunately, it was already metastasized. And so from that point forward, I became a patient advocate. And she lived over 5 years, even though she was given a few months to live. And that drive and also the why she was an outlier, a lot had to do with three things. One is we found a community of peers, which are exactly like her, down to the exact same profile of cancer, tumor markers, We use them to find resources around the world to educate ourselves. And then third is that she was tracking all her information, and she could correlate a lot of the side effects with medications and improve quality of life by changing things. It could be dosages, or it could be timing of medications, separating the two. So all this helped her navigate her own body, and that was the genesis for Zamplo. Uh, Zamplo was trying to do something that nobody else has done before, which is create a crowdsourcing platform. And so, just like how we use the crowd of people to help us, what Zamplo will do is use the crowd of people to help you. And a testament to this was when my wife had to make a decision between whole brain radiation and a targeted drug. We used the crowd of people, and they gave us their data in order to analyze it, and we were able to find that the drug was actually more effective, and that's the path we took. So we basically crowdsourced the data from our peers, and that was published in the Journal of Thoracic Oncology, and that methodology is part of Zamplo, which in the future we want to do that for anybody with any disease. So that's our ambition. And as HPV being global, we are also global as well. So it's about helping anybody in the world, no matter where they are geographically. And also, it's the important thing which we found was about wellness. My wife didn't want to be identified by her or labeled by her disease. And so that's why we're a wellness app, not a disease app, because so many people, that's what they're focusing on, is health and wellness. I'm also, as a patient advocate, my background is in computer engineering, and a group of us have written a declaration of patient health data rights and obligations. It's difficult to get your own data. Sometimes you have to pay for it. And so what we created is a declaration, which is an obligation of custodians to provide the data in machine readable format while respecting privacy and security of data. As a patient advocate, I'm also on what's called the Primary Integrated Healthcare Innovation Network, which I represent Alberta, and we are a group of patient and caregivers that advocate for us to be more involved in the research and the direction of research. Yeah. So before I continue, I want to say one thing is, by all means, please ask questions. I want to make this interactive. We do have polls, which I'll launch, and just to give some more insights into the group. But what I'll do is at certain points when we have the polls, there's 3 polls, I'll stop to see if there's any questions. Okay. I talked a bit about our own citizen science, me becoming a citizen scientist and researching data from our peers. This is just a slide to articulate when we went to find people, where did we find them, right? So this was actually people we found around the world that had the same profile as my wife. And what it did, it allowed us to connect with people and peer into the cancer centers that they've been treated by to get better insights. And this, for example, an example would be CT scans were the norm for brain CT scans was the norm, and they did a reactive. So if you had any cognitive impairment, they do a CT scan, and then based on that, they would take an action plan. And it was a very reactive approach at our cancer center in Alberta at Tom Baker. And through our community, we found that that's not the standard. MRIs are the standard, and people were much more proactive. And that gave us confidence to fight for that, and that's what we got. So we feel that the whole notion is, if we could band together as a community, find what the best practices around the world, and influence the system from the outside in, is how we could change the system to improve patient care. So I'm going to stop here. This is actually our first poll, because we talk a lot about data and digital health, especially with COVID. It's becoming much more prevalent and virtual care. And so I'm just curious to know how people actually record their information and how they feel comfortable. So I'm going to let everybody, including the panelists, vote. So I'm just going to launch the poll, and yeah, so let you guys vote. I'll give you guys just a minute or so. The panelists can vote as well. Yeah. Okay. So it looks like I'll just end the polling so everybody can see. I'll share the results. And so what you can see here is that most people find security and privacy of data to be the most concern. And that's, I think, self-evident in the sense that it is personal health data. And so we will speak to how Zamplo, provides security and privacy of data. All the data is stored in Canada. It's always encrypted at rest, and we have measures to make sure that it stays that way. And no data is on your device, and you have the right to be forgotten. So it'll be all wiped if you choose to. Yeah. So I'm going to pause. I'm going to see if there's any questions. So the question is, what happens to all my data if I delete Zamplo? So if you delete the application, then what happens is all the data in the database as well as the backups instantly get wiped. It's not recoverable, and but you could do it without emailing us. You could just go in the app, go to your profile setting, edit, and then say delete, and you'll be able to delete your profile. So then it does all get wiped. That includes all your photos, any of your lab results, if you put up there, any of your notes, etc. It all gets wiped. Yeah, there's no trace. Okay. So Zamplo, as I mentioned, the backstory of Zamplo was about a lived experience with my wife going through cancer. And so our mission is to connect everybody to their data, the resources and community to live their best possible life. And so it's not a disease app, as I mentioned, it's a wellness app. It's about no matter what you're going through, how do you live the best possible life? And so throughout this journey, since we started to partner with patient organizations. And as Teresa mentioned, we've partnered with HPV Global. And the part of this partnership is about understanding what people with HPV need, influence and co-creating Zamplo to help people, not just with cancer, but also on the mental health perspective. And if you go to our website, zamplo.org/HPV Global Action, you will see there kind of the highlighted areas of Zamplo to help you. And from there, you can also, this is actually the landing page for Zamplo's collaboration with HPV. And on the top right-hand corner, you could download the application. It's a free version. It was funded by Alberta Cancer Foundation, and anybody in the world could download the free version. We do not sell the data. You can start using the application. There's a premium version, which is $5 a month. And also then we also are used in clinical studies as well. So we're very transparent on how we fund the platform. It's through the premium version that subsidizes the free. Yeah. So I'm going to talk a bit about whole health data and body awareness and how important it is to track your information to correlate. Because like what we find is that when your body and your health, your body is communicating to you. It's telling you a story. the question is, how do you capture that? A lot of people capture it in their memory, and then they forget about it. So imagine you could capture that information into one location and then start correlating this data and sharing it in order to solve the challenges that you're facing. So part of the first question is the first step, I should say, is collecting your own data. And so what does that mean? So that's collecting your lab results. We used to ask our clerk or the nurse for a copy of the information. It was just easier. Now there's patient portals for you to log in and download. Many people have MyChart. This is always good to download your information. MyChart, for example, is not necessarily good to record your own information, which I'll get into. The other thing which we started collecting was our diagnostic imaging. This is because if we wanted a second opinion, they want to see longitudinal data, which is data over time. And so we started collecting these CDs, but who has CD players, right? So we had to buy a CD player, and then we had to upload this data. And now with Zamplo Premium, you could upload all your diagnostic imaging into Zamplo. You have enough space for these CDs, and then you can share it pretty much instantly with anybody you feel important. Your practitioner's records. So often hospital systems, which is what patient portals are connected to, are not connected to your GP or your other allied professionals, like your optometrist, your dermatologist, or other specialist. And so taking notes, possibly even information from them, is always important. If you want, you can go to your health records department and collect them. But one of the things which we struggled with is we originally came from Ontario, then moved to BC, and then Alberta. And the challenge there was the data was fragmented. So the system gave us patient portals, but at the end of the day, we had to keep and collect all our information. And that's why we felt it was very important. When she was pre-diagnosis, when we went to the doctor, we didn't do that. And so it was our burden and responsibility to narrate her story from like, when she was very young up to now, what her health history was. This is why it's important to keep it with you. And with Zamplo, it follows you. It does not follow the province that you live in. ER discharge summaries are very good. We often had our oncologist ask for that information. Same with labs. Our naturopath will ask for labs because they don't have access to this information or they're too busy. So by adding all this information, it was important. What I did is I took a consent form that you could pull from your health authority, and I got that basically signed indefinite access to my partner, and I kept a copy of that with me. So whenever I went to the hospital, I would gather that information, and I had the consent form with me. But it's important to know that your medical records is not your whole health. Your mental health notes are important. When you exercise, what triggers maybe possibly anxiety or other challenges. All this is patient-reported outcome measures, which are important. And then you have complementary care, exercise routines, maybe some handouts from your practitioners, where to put it. You could put that into Zamplo as your virtual binder. It's one stop for everything. And then you can give that information for your second consult because it's all consolidated to one location. So more information you have, it's easier for a practitioner. This was how pre-Zamplo, how we collected our information. You had your notebook, you had your infamous paper binder, you had photos on your phone, CD wallet. Then we started graphing information. This is a tumor marker. It allowed us to find when tumors were progressing, when her tumor was progressing before she had symptoms, so we could be proactive than reactive. So there's many, it was very analog, and this is what was part of the genesis of Zamplo. So I'm going to go into another poll, and then I'm going to answer a question. But I'm just curious to know, how do you connect with people who are like you, facing the same health challenges? I'm just curious to what people use. There's a variety of ways, so I'm going to launch that poll and then go into answering some questions. So I'm just going to go to the second poll and I'll launch that. So I'll give you a few seconds to answer that. So we have a few questions. So please bring them in, or sorry, please ask away. They're good questions, and I'll get to it. And so I'll give it just a few more seconds, then I'll publish the poll. So I just published the poll, sorry. So I'm going to share the results. So this is quite insightful. So the question was, how do you connect with people facing the same health challenges? And so Facebook groups are very common to connect with people, very valuable. There's a lot of Facebook groups, and they're increasing exponentially. The second was that people don't, but if there was a way, they would, which is good to hear. I think that there's a lot of friction in finding people, and that's because it's just hard to look for people who are exactly like you. And so I'll go into how Zamplo does it in terms of connecting with people, but it's easier to demo that. Right now, I'll go into the questions. Just stop sharing the poll. And so we have a couple questions here. So the question is does it ever happen that a healthcare provider at ER or a doctor's office doesn't want to give you the report? It does. I've heard it happens that there's resistance, but it's less so now because the culture is changing. People are demanding it. It's actually one reason why I'm working with patient organizations in respect to the declaration. Saying that, in our declaration, is actually states that it's anchored on a Supreme Court case, which says that everybody owns their data and everybody has rights to their data. So, but if people are defensive, what I do find useful is narrating a story that by them giving you your data, you could be more educated, more informed about your health, and ask better questions. So basically talk to their highest value as a practitioner, because that's what they want you to be. And so just reframe it, right? Some doctors have become defensive because they wonder why you want the data. And so if you frame it that, it helps me, give me peace of mind, and also empowers me, they'll be less defensive if you ever get in that situation. But legally speaking, you have access to your own data. The other question we have, can I only record written data, or can I record pictures as well in Zamplo? Definitely you can do pictures. You could do pictures. You actually could do pictures or reports. You take photocopies of it, and we have what's called OCR, which actually scans all that information and indexes, so you do a keyword search. And that's something that I'll demo later on. But you could definitely record anything. You could actually upload videos, so we're not restricted. And that all came from learned experience. So we had a person who would video the chemo port and cleaning it, and then the whole family would be taking turns helping mom in this case with cleaning the chemo port. And so one person would record it and would, instead of sharing it on the phone, they just log into Zamplo and they had it there with them. Yeah. So the power of empowering physical health. So I'm going to speed through this just because I would like to give the demo and make it more interactive. And so part of empowering physical health with data is recording your health in terms of your side effects, interactions with food. It could be exercise, it could be pain. And so this is about creating routines. right? It's known by creating routines, you create habits. It means it's less things to think about, and you stick with it if you create a habit. And so habits are called routines in Zamplo, and I'll be showing that. And habits also could be used for mental health, right? Mental health routines. That could be exercise, that could be just recording how you're feeling. And so by empowering yourself with mental health, it means creating habits so you can think less about what you have to do. Habits are some things that are, in the subconscious. The other thing which routines allow you to do is prioritize yourself, right? Prioritize your own mental health. And then the third thing which we want to do is empower caregivers. So all this collection of data, what is its purpose? The purpose is empowering, right? So you could have your data to help yourself physically, mentally, but also sometimes you get tired of sharing your own data. Repeating your story. And now here's a tool for you to grant access to somebody, be it a family member, anywhere in the world. They could log in, they could see your information, they could see your photos, and then if they have a medical background, they could even add questions for you. Best practice when setting up routines. So the reason I'm focusing on routines because it's important that there's so much going on when you're going through a health crisis or even every day that routines reduce that burden, but also allow you to move forward with your health. And so this is the third and last poll. What do you find tricky in terms of capturing your own routine? The next few slides, in terms of it tells a bit about best practice about routines, but I'm just going to put up that poll. So I'm going to launch the poll, and then I'll share it. I think I forgot to share the last poll, so I'm going to share the poll later. But the question is like, what do you find tricky? Yeah. Okay, I'll give you a few more seconds. Okay, I'm just going to end the poll. I'll just share the results. So the results are, the top one is finding time and balance. And I think having a methodology to make this efficient will help find time and balance. Motivation was a second. We did the same poll to Alzheimer's, an Alzheimer's group, and their highest one was motivation as well, and the second was burnout. So it's interesting that different people have different challenges to get into a routine. Yeah. Okay. So I'm going to go into a bit about what habit research has talked about. So just food for fact of food. Sorry, is it fact for food? But all I'm saying is here is that it takes on average 66 days to get into a habit. Right? Habits are subconscious, so it takes practice and takes a routine. And to be successful, it's best to start small. Right? One or two things a day. Then you go into the more complex habits. So you just build up upon it. So for me, my habit, my routine is I do some meditation. I take my vitamin D, and I do some salutation. So those are my three routines that I do every morning. For my wife, she had a regime for medication and supplements, in addition to her affirmations. And so she got into this routine, which means that she didn't have to think about it. So I was saying, start small, If you skip a day, it's okay. Link your routine to your highest value. Why are you doing this? It's for health, it's for fitness. What they go a little bit granular, and then also establish the right support system. So part of Zamplo community allows you to connect with others who are going through it, and so you could connect with each other and talk about it and see what works for you and share that. Because part of being a coach is actually allowing you to reinforce your routine, reinforce your best practices. So I'm going to go into the application. I'm going to pause and see if there's any other questions. Okay, no more questions. And as I was saying, this is our website. What I'm going to show you a bit about is the application, a few slides on it, and then I'll go into showing the application itself. And so, as I mentioned, we have security by design, which means that we continuously design it with security and privacy in mind. So nothing gets into the application without thinking about these two attributes. All our security or privacy policies on our website for you to read. The whole concept of Zamplo is about taking this fragmented data set, which I talked about in the beginning, which either is derived by you or the health system, and unifying into one spot for you to analyze and share it with whomever you want. We're going to start with a persona, Holly. So Holly has cervical cancer. She's in university, and she has certain symptoms, and she's taken certain medications. And she also has certain activities. So how do you manage these three during a busy schedule as being a university student, right? And so we'll show you a bit about how she uses Zamplo in terms of the health data she tracks, how she created routines, even ad hoc, how she creates, records her information and analyzes it as well. This is how a routine looks like. I'll go through this quickly because I'm going to show it to you live. Right? But this is a routine to track her cervical health monitoring. Then she actually graph her information. So this is how a graph looks like. She has a list of medications. So the whole concept here is if you go to the ER, often they ask you what medications you're on, right? They don't check the system because that's what's prescribed. They want to know what you've taken, prescription, non-prescription supplements, and so here's a application for you. And at the end, I'll show you community, and this is how to link with others. Okay, I'm going to switch over to the application now. Okay, so I've already so you can see my. Okay, you should be able to see. Just want to confirm you can see my screen.
Yes, we can.
That's great. Okay, so Zamplo is available on web and also on your mobiles, and so you could download the application if you want, or you could use a website. So I'm just going to log into the web version of our application. It's available on Android as well as iPhone and any browser. And so I'm just going to close the graph and just show you how the dashboard looks like. And so you have a dashboard here, which allows you to record your information. You have then your health routines, and also here's a list of all your medications and activities that you could use to track your information. And so let's say you want a quick note, right? You can add a quick note here. It's like it's gloomy, but my mood is okay. So just a comment, you could actually add attachments. So there's a question on is it just notes? No, you can actually add attachments. Either just take it from your camera phone or your camera, or upload a file. Once you upload the file, it gets attached as a journal. And then once it's attached, you can actually see it in your list of journals here. And I'll go through this, but this is how your journals look like. And as you can see, here's a rash, for example. Somebody took a photo of a rash just to log it. So if you go to the doctor, you could have a conversation, a more meaningful conversation. So I'm just going to go to the dashboard here. And so that was what's called a quick note. You could do a to-do, which is basically a task. You can also enter a new journal. What I'm going to show you here is, for example, your medication tracking. So I clicked on here, and these are templates that you've created. And it's you're taking a cream. You also have another medication. Let's say, you know what, you want to track a symptom right now. So this is basically a routine that you're completing. And my pain today is, it's 6 out of 10, right? And you could save it. Now, these routines that you create can be, you can set a routine and also a notification, so you get a notification when to complete the routine. So the whole concept is that you create these routines right from a journal, create a template. That could be anything from tracking your symptoms, right? Or even could be symptoms. It could be even your health data, any medications, or even activities. You could track walking, for example, if that is deemed as a therapy. You decide what you want to track, right? And then once you're in your journals, you could always track this. So if I did a pain here, I actually could look at all my journals where I've tracked my pain, and actually I could look back and see them. And as you can see, it gives me my history, my story, as I track it. Right. Going back to the dashboard, you might have ad hoc, just take an Advil. So again, I take an Advil, it takes a day timestamp, let's say it took 2. So often we put this in here is because when you go to your doctor, they're trying to find out what medications you're on and how often you're taking it. What they're trying to find is your dosage, because then they could find out your pain tolerance or where it is and then change things up. They need this information. So more accurate information is better. So this is how you use a dashboard to track your information. I'm going to go into some of the reports you can create, but I'm going to answer a question here. So the question here is where would I get the notification sent to? So right now, if you're on the web, you have 2 choices. You get an email, or it comes under this notification button. So this will complete your journal, cervical health monitoring. I clicked on this, it opens up a journal because it has a reminder set, and I can just complete it. In fact, what I could do is I could say copy from previous and nothing changed. I copied it, and this was exactly the same as what I previously entered, right? Remember, I had 3 units for the episodes, and I say save, and you can save it. So notifications come from email if you use a web app, and also push notification if you're using mobile. So you'll get a push notification and a chime to notifying you to complete it. So coming back to the dashboard, so this is the day in life of entering the information. Let's say if you had to go to your ER, you could have a list of all your meds. If you go to your doctor, you could actually tell your story by a graph, right? You could even download this graph as a PDF, and you can analyze this information. If I actually expanded, I could start exploring this information and actually seeing how things are correlating. Right? So this is all in the power, in your power, and that PDF that I have could be just emailed to your practitioner. Not just your practitioner, it could be your naturopath, it could be any other practitioner you want. What I'm going to show you here is the attachments. So what I wanted to show you here is attachments. And the reason here is because what we have a unique feature is that you can take all your paper binder and make it virtual. Meaning that if I will type in a keyword search, I actually found my PAP test. And this is a piece of paper, but Zamplo actually indexed all this information and allowed it to for you to look it up. You could do COVID, for example. Somebody asks for your vaccine card. So here's a vaccine card. So again, it's actually reading this piece of paper, which was provided to Zamplo through a photo. So this is how you could virtualize your whole medical record. This is a photo of an MRI. And so you have all your information here in one spot. You could search it. If you give caregiver access, which is right here, Adam Hart is my caregiver. Adam Hart could log in and look at this information as well, so they could advocate for you. Yeah, and the last thing I'm going to go through, there's quite a few features here, but I want to highlight the community, and then I'm going to open up to any questions. And so what we have here is basically a list of your connections. And if I go to my chat, I could list here all the people who I'm talking to. So for example, I have people here which I could click on and I could start chatting with them. And you can have a one-on-one conversation. Now, some people ask, well, who's Lex? If you go to my connections, you could actually show you right here, and that's Lex, and it has the information on the conditions and their story. There's a bit of a bug here because it doesn't display all the conditions, but I actually did a search for, we have people with cervical cancer, which is what Holly has. And so the way you find connections is I went to find connections. I said, I want to look for people like me, people with cervical cancer. You could add more treatment or more symptoms. And, you could narrow your search. You could say, do a search, and you could actually find all the people that have cervical cancer and their story, right? So as you can see, it actually allows you to narrow your search and find people. Once you find them, you can connect with them. You can send them a message. To be honest, it's like a dating app. It's actually very much inspired by how people match for dating. This is a different purpose, of course. And I sent a search. I canceled my search, and if I went to my connections and I looked at the sent box, it's a pending connection right here. Okay. So, and for myself, this is how I create my profile. So again, we don't expose your personal information. You control what is exposed, and it's very limited. So it's basically you create a username. You could have your medical condition, and then you could also have share a bit of your story. And then this becomes, so you could actually, your medical condition, it could be anything. It could be a medical condition, it could be mental health. You create your profile, and based on that, you can match with people. Okay, I'm just going to go back to the chat box and then look at these questions that we have. So the question is, how precise is the match feature in community? And the other question is, does the community feature allow also send notification if someone messages me? So the precision of the matching is very precise because it actually, you could search for people with the same medical condition, treatments, or symptoms. And you could actually click. So let's say you have cervical cancer, you're on Aldera, and you're having headaches, and you want to find people anywhere, anybody on the network, and you do a search and it looks for people. Now, you can even do it by age if you want. Now, nobody has that criteria, but it's very narrow. The other question that we had was about notifications. Yes, if you get a sorry, if you get a notification or you get a message in your chat window, you get notified through a push notification that there's a message waiting for you. And so when we launch that, that will be available. And so you can come back here and have a conversation. Again, it's fully private, it's secure, it's one-on-one communication. You could disconnect with the person and you can report them if you feel you need to. Yeah. And so the other question we had is this platform available in French? Right now, it isn't, but we plan to start our translations in the fall. But we do start to make, we plan to make this into French, Spanish, German, and Italian. And so it'll become more universal. It is a global app. We do have people around the world using the platform, but right now it is in English. I think the other question we had is, can I search for people in specific regions? Yes, you can. So if you look at your profile, sorry, right now, you can't do a search for people in a particular region, but we do plan to do that because you can put your city and your country in here. But we will expand it to do based on country or city in terms of your region. Yeah. Look at a connection. Sorry, I'm wrong. We did, no, yeah. So we are going to expand this to include geographic region, but right now we don't have that. The other thing which you can do is look for people who are caring for people like with cervical cancer, or also with patients. So again, we appreciate the value of caregivers, and sometimes caregivers wants to talk to other caregivers. And with our connection, you could do this. So in summary, Zamplo is a tool, unlike others, that the community aspect is different from, let's say, Facebook group. Facebook group has a purpose. This allows you to do a secure, private, one-on-one communication and narrow down and talk to a person exactly like you. You can actually track all your health here as well. And you can share with whomever you want. It gives you the full control. So I just want to finish up here and open up to any questions. But the whole concept here of Zamplo and our partnership with HPV Global is to give people a tool to be more empowered with their health and find a community anywhere in the world that they could connect with. And we feel that in itself is empowering and allows you to move forward in your health journey. I'm going to stop here and see if there's any questions on the app or Zamplo or with security. I'm just going to move to the slide with our contact information of myself and Teresa, and also our website information as well. And as mentioned, this is going to be recorded. So if anybody have any questions or wants to play this back later, they can. Please contact me or send an email to info@zamplo.org if you're stuck. We're here to have a personal Zoom call and help you out. Okay. Thank you. I was going to answer a few questions.